Alright, it's time for psychiatry review for step 2. In this video, we're going to cover all psychiatry concepts for the USMLE step 2. We're going to have 200 questions and some awesome mnemonics along the way. Now, slides and the cheat sheet can be found at my website at ajmonics.com. Now, before we start, I want to mention that at AJ Monics, we're going to have amazing updates coming 2024. And for those of you who like these step 2 review videos, don't worry, endocrine pulmonary are on their way. They're coming soon. So let's begin. Question 1. What do sertraline, escitalopram, linezolid, and these other drugs have in common? And the answer is, they all have I in their name. Just kidding. It's true, but that's not what I meant. What I meant was, well, here's a hint, SS, and the answer is serotonin syndrome. All of these drugs can cause serotonin syndrome. Linezolid, actually I had this on an exam, linezolid is an antibiotic that can actually lead to serotonin syndrome. But of course, sertraline and escitalopram are easy, as that's their mechanism, they increase serotonin. But these other drugs can also lead to serotonin syndrome. So again, all these can induce serotonin syndrome, and that's why we wait 2 weeks after an MAOI, monoamine oxidase inhibitor, to start an SSRI, to allow a washout period, to avoid a serotonin syndrome. So again, we mentioned 2 weeks, but there's actually an exception. For fluoxetine, you have to wait 5 weeks, and that's because fluoxetine has such a long half-life. For fluoxetine, you have to wait 5 weeks. Now, before we get to question 2, please know the difference between serotonin syndrome and neuroleptic malignant syndrome. In serotonin syndrome, we see these symptoms. Remember, increased reflexes, whereas in NMS, we see lead pipe rigidity. And that's why we see this lead pipe over here to remind us of the lead pipe rigidity seen in neuroleptic malignant syndrome. In terms of treatments, well, serotonin syndrome is treated with cyproheptadine. Get ready for a terrible mnemonic. You can make fun of me for this mnemonic if you'd like. You could even tell your friends how terrible this mnemonic is. Here it goes for serotonin syndrome. Here's the SSRI, and here is Sarah. She likes to lie down on the SSRI, as SSRIs cause serotonin syndrome. So here's Sarah, and here is her toner. She likes to put toner ink on herself. All right, so here's Sarah with the toner for serotonin. And here is the sipping hippie-dean. Anyway, Sarah has serotonin syndrome and someone needs to help her out. Who's gonna help her out? Here's the sipping hippie-dean. This sipping hippie-dean, it's like a dean who's a hippie and he's sipping something. So the sipping hippie-dean for cyproheptadine is helping Sarah with the toner to help us remember that cyproheptadine is for serotonin syndrome. A terrible mnemonic, but I guarantee you'll never forget it. Question 2. A diagnosis of schizophrenia requires hallucinations, delusions, or at least 6 months of symptoms, and the answer is at least 6 months of symptoms. Schizophrenia usually comes with hallucinations, but they are not required for diagnosis. For example, a patient can have negative symptoms, but diagnosis requires at least 6 months of impairment. If it's less than that, well, less than 1 month, it's brief psychotic disorder. If it's between 1 and 6 months, it's schizophreniform disorder, and if it's more than 6 months, that's when it's schizophrenia. And remember the 5 A's of negative symptoms. Question 3. What is this condition? Well, remember, this is the psychiatry question, so the answer can't be A or B, and that's why it's C. Well, let's explain why. Here, the hair loss is incomplete, and there are hairs of various length. In alopecia areata, we see more of like this circle, completely bald patch. And in telogen effluvium, that's kind of like a fake disorder. It's not really a disorder, so the person's hair is like thinning. All right? And trichotillomania, in case you're interested, comes from the Greek thrix telein mania. Question 4. Schizoaffective disorder diagnosis requires a history of psychosis plus mood. Mood means depression or mania. And what's the qualification? That the psychosis must be for at least 2 weeks without a mood episode. So again, to diagnose schizoaffective disorder, we have to have psychosis for at least 2 weeks without any mood symptoms. The patient cannot be depressed or manic during that psychosis. Question 5. EPS symptoms are seen in typical antipsychotics or in atypical antipsychotics. And the answer is, in typical antipsychotics, we see the EPS symptoms more. We see them a little bit in the atypicals, in the second generation ones, but they're mainly seen with the typical antipsychotics. Remember, typicals are the first generation, atypicals are the second generation. All right, and here's just a fantastic slide on the difference between typical and atypical antipsychotics. Take a look at this. This is extremely high yield. And again, you can find all of these notes on the cheat sheet at my website. Question 6. Trazodone most commonly causes priapism or somnolence. So here's something interesting. Oh, I made a mistake here. I meant if you get this wrong. If you get this wrong, you're a 3rd-year medical student. If you get this right, you're a 4th-year medical student. Let's see. Are you going to get it right? Somnolence. Trazodone causes somnolence in everybody. It causes priapism only about 1 in 1,000 1 in 5,000. In fact, priapism only occurs 1 in 10,000 people in general. Trazodone just takes it to 1 in 5,000. You'll meet psychiatrists who have never seen trazodone cause priapism. But the people who write the boards love priapism, and therefore they talk about trazodone causing priapism. And that's why you have to know that trazodone causes priapism, but when you get to rotations, you'll see that trazodone does not cause priapism, it causes somnolence. At least more percentage-wise. Here's just an unnecessary picture on priapism. Question 7. I feel like I'm watching myself go about my day. What is this? This is depersonalization. Remember, depersonalization is I am outside myself. I'm not deep person in my body. I just made that up. It's pretty awful. And derealization is it feels like you're not real. It feels like you're in a movie or a dream. Are you real? Is derealization. And depersonalization, derealization disorder is when you have either one of these, either recurrently or persistently. Question 8. A diagnosis of generalized anxiety disorder requires, not sleep disturbances, that could happen, but at least 6 months of worry on most days. So again, schizophrenia was 6 months. Generalized anxiety disorder, you also need 6 months. And here, worry on most days. Again, sleep disturbances are not required, but they're often seen. And here's just a little bit more about generalized anxiety disorder diagnosis. It causes significant clinical impairment. Question 9. GAD first-line treatment is... What's the first-line treatment for GAD? I hope you don't say A. D. Buspirone is not first line. In fact, if you ask psychiatrists, they don't really like it so much. They give it to people sometimes just to make them feel better. Or they have contraindications to other anti-anxiety medications. Beta blockers, that's for performance anxiety, where you can't give a speech without peeing in your pants. And benzodiazepines are for the short term, not first line. All right, and here are the SSRIs. I wrote here on the bottom that benzos are given for acute management in panic disorder. Question 10. Abruptly stopping which anti-anxiety medication is very dangerous? And the answer is clonazepam. Remember, stopping benzos right away can cause seizures and death, kind of like alcohol. Remember, on test day, the 2 dangerous medications to stop right away, benzos and alcohol. Stopping opioids right away doesn't kill you. Stopping cocaine right away doesn't kill you. Clonazepam and alcohol, stopping right away, can kill you. I am terrified of being alone in public places. This is agoraphobia, fear of crowds. I only feel safe at home, often associated with panic disorders. Because you had a panic disorder in public and you're scared of having it again, you're scared of being trapped in the crowd. We treat social anxiety disorder with CBT and SSRIs, and again, for the performance-only type, propranolol. Question 11. Which condition is egosyntonic? I want to have this condition. I don't want it to go away. OCPD. OCD patients do not want their obsessions and compulsions. In OCPD, they have a personality disorder, and they don't even think that there's a problem. Why would they want to get rid of it? Question 12. Besides SSRIs, which medication is proven to treat OCD? Clomipramine, a TCA. Not the other TCAs. For some reason, clomipramine is a TCA used to treat OCD. What is the treatment for PTSD nightmares? Prazosin or Prazosin. You choose how you want to pronounce it. This is an alpha-1 blocker used to treat PTSD nightmares. And here's a little bit about PTSD. Remember, if it's less than a month, it's called acute stress disorder. Question 14. A fixed false belief is a delusion. An illusion is misperception of something real. A hallucination is perception of something not real. And a delusion is a fixed false belief. By the way, antipsychotics eradicate a patient's delusions. True or false? Generally, this is false. Although antipsychotics can help with hallucinations, with delusions, these are much harder to get rid of. Medications typically don't eradicate them. However, the patient may be less persistent or fixated on the delusion. And here's just a fascinating condition, folie à deux, which is a shared delusion between 2 people. And in such a case, it's best to separate the 2, the parent and child, for example, and treat them individually. There was actually a case in the news where a father and son had this condition. The father had this delusion, and he kind of sucked his son into the delusion as well, and they both killed lots of people. Of course, they were both put in jail. And here are other names of folie à deux. Probably not going to see this on the exam, but still pretty cool. Question 15. After Alzheimer's disease, the most common cause of dementia is vascular dementia. Alzheimer is 65%, vascular dementia is 20%, and the other 15%, you can take a look over here. Question 16. A patient has a mini mental state exam, score of 14, normal is bigger than 24. Does the patient have dementia? And the answer is not necessarily, because remember, this test only assesses cognitive impairment, but you do not only get cognitive impairment from age, you also get it from marijuana, cocaine, and heroin. All right? There's no specific test for dementia. Well, actually, you can get a brain biopsy and pathology, but obviously that's not routinely done. All right, and here's just the difference between delirium and dementia. Delirium is also known as encephalopathy or altered mental status. These are literally the same thing. 3 ways of saying the same thing. They have an acute, fluctuating course and are reversible generally, and we treat the underlying cause, versus dementia, also known as neurocognitive disorder. You can take a look at the rest over here. Question 17. A depressed patient has hallucinations which occur only when the patient is depressed. Is this major depressive disorder or schizoaffective? And we said, since it's only occurring when the patient is depressed, this is major depressive disorder with psychotic features. Because in schizoaffective, we have to have psychosis independent of the mood for at least 2 weeks. Remember that. And again, major depressive disorder with psychotic features. Question 18, first line for borderline personality is therapy, dialectic behavior therapy. In case you're interested, this is what it involves: mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness. Probably not going to be tested on this, but you do need to know that DBT is first line for borderline personality disorder. Question 19, convulsions, coma, cardiac arrhythmias, CCC are for the TCAs, TCCCAs. TCAs involve these C's as side effects. Also, orthostatic hypotension, dry mouth, and urine retention. I can turn a red light green by clapping my hands. Who can turn a red light green by clapping their hands? People with magic. Who has magic? The schizotypal disorder. In schizotypal, I always imagine this guy in a magical suit typing on a computer. For schizotypal, again, they're the magical ones who dress in funny outfits. I'm not trying to make fun. I'm just trying to describe the condition. All right, magical thinking. And schizoid is the loners. Schizoids decide to be alone. I like schizoids decide to be alone because schizoids decide to be alone because they like to be alone. Question 21. I think I worded this wrong. An appropriate initial medication for a patient with major depression. For a patient with major depression, insomnia, and weight loss. So let's say a person's depressed, they can't sleep, and they have weight loss. We want to give them mirtazapine, because mirtazapine leads to weight gain and sleep. I have a mnemonic on this coming up on my website. I'm really excited to show it to you. And amitriptyline, well, TCAs are not first line, as we said. Question 22. A patient has suicidal thoughts 2 months after his wife passes away. He states that life is no longer worth living anymore and he can't get anything done anyway, and he hates himself. Is this normal? No, this is major depression. In major depression, we see self-hate. In normal bereavement, we see the self-esteem is preserved, sadness, and the sadness is specific to the dead person, and the person is still functional. In major depression, you can take a look at diagnosis over here. Question 23. Which antidepressant is contraindicated in eating disorders? And the answer is bupropion. You'll hear this called Wellbutrin in the psych ward. Wellbutrin or bupropion is contraindicated in eating disorders because it lowers seizure threshold. I always imagine a blue protein pain tank having a seizure because because bupropion lowers seizure threshold. And this applies to both anorexia and bulimia. They should not take bupropion. Again, trazodone causes sleep and priapism. Question 24. Tardive dyskinesia as a side effect of antipsychotics occur when? Well, tardive, the reason why it's called tardive is because it happens late. Tardy is late, after months or years. And here is the timeline of the various conditions, the side effects of antipsychotics. All right, tardy again means late. I can't fit isha. I can't fit isha reminds us of akathisia because akathisia is when the patient can't sit still. It's kind of the same thing as restless leg syndrome, just restless leg syndrome only occurs at night and affects the legs. Akathisia can happen even during the day and it affects the whole body. So this is akathisia over here. Again, I can't fit isha. I can't sit down because I'm so restless. And again, here's just more on the timelines and on the treatments of the extrapyramidal symptoms. Question 25. Adjustment disorder. I wrote adjustment order. Adjustment disorder develops within 3 months after onset of stressor and doesn't last more than 6 months. Then we need to start thinking about major depression. And it causes occupational or social dysfunction. Question 26. What's the treatment for adjustment disorder? And the answer is psychotherapy. No medication for adjustment disorder. Question 27. A patient has chronic depressed mood that is present on most days for more than 2 years. What is this? This is not major depression, this is persistent depressive disorder, but they could actually develop an episode of depression, and that would be called double depression. You're unlikely to be tested on that term, but in case it comes up, you'll know what double depression is. Question 28. Can mania involve psychotic features? Of course it can. We often find in the psych unit that patients with bipolar, during their manic episodes, have psychotic features. They literally think that they're the president of the United States. So again, in mania, yes, in hypomania, no. Question 29. Which mood stabilizer caused this? This was caused by well, this is Stevens-Johnson syndrome. This was caused by lithium. Lithium is one that leads to Stevens-Johnson syndrome. And here's a Stevens-Johnson mnemonic, the things that can cause Stevens-Johnson syndrome. Phenytoin, carbamazepine, phenobarbital, lamotrigine, allopurinol, penicillin, sulfa drugs, and erythromycin can all cause Stevens-Johnson syndrome. So if you start taking one of these drugs and you develop a rash, stop taking them, because Stevens-Johnson syndrome can develop into toxic epidermal necrolysis and can be deadly. Question 30. A mood stabilizer that is first line for trigeminal neuralgia is carbamazepine. Carbamazepine for trigeminal neuralgia, or oxycarbamazepine. This comes up on exams all the time. Question 31. A mood stabilizer with a narrow therapeutic window that causes Epstein anomaly. I'm so excited to show you the mnemonic for this one, but this is lithium. Lithium, Epstein anomaly. Lithium, by the way, reduces suicide risk the most of all mood stabilizers, and probably more than any antipsychotic as well. Question 32. An MAOI and HTs can lead to hypertensive crisis, which basically means hypertension that's really high and really abrupt. This can be caused by any high tyramine food, such as red wine. Question 33. Postpartum psychosis requires hospitalization. True or false? And the answer is, this is true. Postpartum psychosis requires hospitalization because she may kill herself or kill her baby. And here's just the difference between the blues, depression, and psychosis. Question 34. A patient has major depressive disorder and SSRI has failed. What is the next step? Another SSRI. ECT, that's for treatment-resistant depression, and phototherapy, that's for seasonal depression. Question 35. First-line treatment for severe mania is valproic acid or lithium plus an antipsychotic. Again, a mood stabilizer and an antipsychotic. In a psych unit, they're not going to call it valproic acid, they're going to call it Depakote. So basically, you're going to get to the psych unit, you're not going to know that valproic acid is Depakote, and they're not going to know that Depakote is valproic acid. So get it down now. Valproic acid is Depakote. And an antipsychotic, an example, is Risperdal or Risperidone. Question 36. A woman is very provocatively dressed. She breaks down in tears when no one notices her. This is histrionic personality disorder. Question 37. A boy has conduct disorder diagnosed in 7th grade. Now at age 21, he lacks remorse and breaks the law. This is antisocial personality disorder. Remember, must be over 18. Conduct disorder in children, antisocial disorder in adults. C, AA. Question 38. I want to go to the party, but I'm scared no one is going to like me. I am staying home. This is avoidant personality disorder because you want to avoid people. But remember, in avoidant personality disorder, the patient does not want to be alone. They want to be around people. They're just scared of rejection. Versus in schizotypal, I meant to say in schizoid over here. In schizoid disorder, the patient wants to be alone. Question 39. Defense mechanisms. A guy has a crush on a girl and then goes on and insults and embarrasses her. He's doing the opposite of what he feels. This is reaction formation. Person behaves opposite their feelings. Question 40. Defense mechanism. The nurse is totally awesome. Oh wait, she insulted me. She is totally bad. That's splitting. Splitting seen in borderline personality disorder. Question 41. I just got fired from my job. I want to kill my boss, but instead I will treat my wife like a queen. So here you're channeling unacceptable wishes into acceptable behaviors. This is sublimation. This is a fantastic defense mechanism. You basically want to act bad, but you act good. Sublimate means to elevate, so it makes sense that we use the word sublimate for this type of defense mechanism. Question 42. A child has ADHD. Mom doesn't want him to take a stimulant, so what's the next step? Prescribe the stimulant anyway, call Child Protective Services, or offer atomoxetine or guanfacine, and of course we offer atomoxetine or guanfacine. Atomoxetine is actually an SNRI, and guanfacine is an alpha agonist, along with clonidine. Question 43. A child gets extremely angry. I gave it away already. A lot! That's disruptive mood dysregulation disorder. Diagnosed only after the child is older than 6. Question 44. The diagnosis for Tourette syndrome is motor and vocal tics. And vocal tic, by the way, doesn't need to be speaking. Can even be grunting for more than 1 year. Treatment for Tourette syndrome: tetrabenazine, a VMAT2 inhibitor, antipsychotics, and alpha agonists. Not as good, but these alpha agonists are not as good for tic reduction. Treatment for Tourette syndrome used to involve more of the dopamine drugs, but not anymore. Now it's more the tetrabenazine and antipsychotics. All right, here's just the term coprophilia, sexual arousal from feces, but I want to focus more on coprolalia or coprolalia, I speak feces, meaning patient says obscene words. Coprolalia, they say obscene words. Echolalia is when the patient repeats words that are heard. The best initial treatment for alcohol use disorder is naltrexone, an opioid receptor blocker. Disulfiram, in contrast, produces an unpleasant response, flushing, nausea, etc. when one begins to drink. But naltrexone is the best first-line treatment. Disulfiram produces an unpleasant response, such as flushing and nausea, when one drinks. Question 47. Antidepressants are used in psychotherapy for which one? Bulimia. Anorexia is resistant. And by the way, I just wrote it over here. Anorexia patients are very skinny. In bulimia, patients are not underweight. They're normally regular weight or overweight. And in bulimia, the patient purges by vomiting or exercising, just reminding us of that. Again, if a patient binges and then exercises, binges, then exercises, that's not binge disorder, that's bulimia. In bulimia, the patient binges and then exercises or vomits afterwards. Question 48. I want to go see what's going on over there. This is voyeurism. In voyeurism, they're observing. Exhibitionism, they're showing. And in Freuderism, they're rubbing. For example, on a subway. Question 49. I hate my gender. That's gender dysphoria. Treat with education and address the concerns. Otherwise, there's a major increase of suicide. Question 50. The patient feigns symptoms because he likes the warmth and comfort of the psych unit. What is that? Not somatic symptom. That's distress regarding a symptom. Conversion is when you have a deficit unexplained by medicine, often after trauma, and factitious is self-injury to assume the sick role either on yourself or on your child or on someone else. Malingering is where you try to get benefit, and that's what's going on over here. The person feigns for financial gain or to miss class. All right. Now, for questions 51 till 200, I think actually 199, my friend Sarah put them together, and I'm not going to go through all of them, but here they are. Here we have a woman who's getting depressed in the winter. That's seasonal affective disorder. Antidepressants take how long to work? 4 to 6 weeks. Don't stop treatment after 3 weeks. Person has an eating disorder that's associated with kleptomania. Believe it or not, eating disorders are associated with kleptomania. Opioids and other sedatives can lead to which of the following? Respiratory acidosis. Opioids decrease the respiratory drive, increase in carbon dioxide, respiratory acidosis. Question 54 is, again, this was trying to highlight the fact that fluoxetine you need 5 weeks before starting an MAOI. Remember, fluoxetine, 5-oxetine. Question 55, patient with ADHD, what's the first line treatment? Methylphenidate. Question 56, bipolar medication causing red rash, Stevens-Johnson syndrome, lamotrigine. You got to stop right away or you could die. Question 57, pain in legs at night. This is restless leg syndrome. You have to check the blood iron levels because that's associated with restless leg syndrome. If that doesn't work, then we can start propranolol. 58, patient vomits after each meal. That's bulimia. Remember, they purge, and we treat that with an SSRI. Remember, not like anorexia nervosa. Anorexia nervosa you cannot treat with an SSRI. In general, you need to treat with psychotherapy. And of course, with nutritional rehabilitation. 59, patient comes in distressed. So this is ego dystonic. This is obsessive compulsive disorder. Ego dystonic. 60, 34-year-old male comes in distress. He states he always has to click the lights 30 times or else bad things will happen. This is an obsessive compulsive disorder, and we treat this with SSRIs. Remember, an alternative was the TCA, clomipramine. All right, you can take a look at the rest of these questions yourself. I highly recommend that you take a look at my cheat sheet. It's about 7 pages. It has everything you need to know for the shelf exam and for Comlex. I really hope you enjoyed. Please stay tuned for updates on AJ Monics, and take care.